This presentation is designed to help you know what to expect when you make it to clinical courses in nursing. Welcome to the clinical portion of your nursing education. Students who have a plan to manage responsibilities and sequester serious study time have made good preparation for success. You are learning the necessary skills for one of the most highly regarded careers in the world. Nursing is embodied in Dr. King's quote, "Every day presents an opportunity to make a difference in someone's life." In this segment of the presentation, we will discuss the varying times of day classes are offered, the great risk of overcommitting while in clinical classes, whether it's from working, family responsibilities, or taking other classes simultaneously, what it means to be a nurse, what a nursing student can expect for time commitments, clinical preparation, and clinical locations, what nursing instructors expect of students. Nursing is a calling. To be a nurse is a calling that's difficult to describe in words. Who can say why a person would want to do a nurse's work? But those who do will tell you there is nothing as fulfilling or rewarding. Nurses stay by the side of those who they serve through the worst times and celebrate with patients and families in the best times. Nursing instructors say that if a student is passionate about nursing, no job is more rewarding. Nursing concepts. Learning and successfully completing nursing will be unlike anything you've done before. It requires a special set of skills in many areas, including critical thinking. When students pay attention to these skills, evidence shows they are more successful. Fall and spring admissions. Classes will be offered in the morning and afternoon. Lab and clinical will be offered in the daytime, evenings, and on Saturdays, subsequent to availability of clinical faculty. There will be times that the clinical lab will be late afternoon or during the day, depending on the course. This course will take 4 to 5 semesters to complete. Courses are sequential. When a nursing student begins clinical courses in August, fall semester, or January, spring semester, they may be attending morning or afternoon classes. But for example, surgery, children's clinics, and OB clinics are available only during the morning, so students must expect to have flexibility. Students enrolled in the generic ADN program have 4 to 5 semesters, approximately 24 months of clinical coursework to successfully complete in order to graduate from the program and apply for the NCLEX RN exam. The clinical courses are sequential and cannot be compressed into any shorter period of time. A student will hear this term mentioned in every nursing course until graduation. It involves critical thinking, assessment, nursing diagnosis, planning, implementation, and evaluation of nursing care. Each sequential course builds on the knowledge, skills, and critical thinking a student is gaining, becoming more complex and involved with each semester. Learning. Memorizing is what you have done all your lives to pass tests. What is your blood pressure? Understanding is knowing how the facts you learned work together. What does 120 over 80 mean? Is it okay? Application is using the understanding to solve a problem. Should I give the blood pressure medication? How and when? Nursing school is very demanding. Students have a hard time believing this slide until they actually enter clinical courses. Then sometimes it's too late. A student who doesn't have enough time to really study will spend the rest of the semester playing catch up for a failing grade. It takes at least 3 hours of study for each credit hour of class. The students we see most risk of failing a class are the ones who add too much to their nursing school schedule. Some students try to retain a full-time job. Some try to combine nursing with other courses. We include this information for your benefit. If you know ahead of time that you are putting yourself at risk, then you can plan for a management of your time and family responsibilities. Other ways your time is used. Online modules may need to be completed and pre and post testing to learn skills. Study habits may need to be altered to fit a new content. The reading is more difficult with unfamiliar terms and content. Some relearning of areas like math may be needed for medication math calculations. Opportunities for unique learning may be made available outside the normal class or lab hours. Clinical preparation. Students may be required to go to the clinical facility the night before the clinical visit to receive their patient assignment. Students should expect to spend time in preparation for instructor discussion and questioning for patient charting, familiarity with pathophysiology and treatment, and a plan for nursing care for the clinical day. First semester. These represent sample clinical skills taught in your first semester. These skills will be taught in the lab or classroom prior to going to the clinical site. Students usually need additional time in lab practice to feel comfortable with these skills. Students have found it helpful to review skills checkoffs in the text and video presentations on the nursing lab computers. Along with fundamentals of nursing, you will also be taking nursing care management and pharmacology. Second semester. Typically in the med-surg classes, once students receive their patient assignment, they will study various conditions, drugs, and procedures. Your clinical instructor will ask you about your knowledge of the condition of your patients to make sure you have prepared for this interaction. Students are responsible for being familiar with patient care, medications, and treatments. Nursing 162. This course covers application of clinical thinking skills in the care of adult clients. Third semester. This is typical schedule for Nursing 229, sometimes called OB and Peds. You'll study acute and chronic illnesses and health maintenance for patients in childbearing years and all stages of childhood and adolescence. Normal aspects of care and growth and development are also covered in this course. A variety of community sites are chosen to provide the student with an opportunity to incorporate theories of human development, growth, birthing behavior, teaching and learning, and family constellations into client care delivery while utilizing the nursing process. Your senior semester. This is the schedule you can expect your last semester. Nursing 221 Advanced Nursing expands the application of the nursing process, critical thinking, planning, implementation, and evaluation of nursing care, in the care of persons throughout the lifespan who are experiencing trauma, burns, respiratory failure, and chronic neurological conditions. Also, the student is provided with the knowledge to lead and manage the healthcare team utilizing appropriate delegation and evidence-based nursing. Students work the same schedule as their assigned clinical preceptor. What instructors expect. You are entering into one of the most respected and trusted professions. We expect you to conduct yourself as a professional, arriving on time, being prepared, making a sincere effort, and taking responsibility for your actions and own learning. That means arriving on time, even if you had trouble sleeping the night before, being prepared by pre-reading content before class, and making a sincere effort by participating in class to understand and clarify. Critical skills for nursing students. A student who is self-disciplined, stays on task as needed, and manages time to focus on priorities. A student who is sensitive to diversity, expresses appreciation of human differences related to values, culture, and personality. A student who is reflective and self-corrective, carefully considers meaning of data and interpersonal interactions, asks for feedback, corrects own thinking, is alert to potential errors by self and others, and finds ways to avoid future mistakes. A student who is courageous, stands up for beliefs, advocates for others, and doesn't hide from challenges. A student who is flexible, changes approaches as needed to get the best results. A student who is empathetic, listens well, and shows ability to imagine others' feelings and difficulties. In summary, student preparation helps make the sacrifices easier to manage for students and their families. The rewards are great. This is what one student said about time and study commitments. You'll study about 6 hours every day, including weekends. Just before a test, it may be more than 6. My family support system has helped me survive. My husband cooks and my parents help with my kids. I couldn't have done it if I had tried to work, take care of my family, survive nursing school, and take general education classes. I think it would be impossible. One reason nursing is so time consuming is that it's a new way to learn. You don't memorize, you take everything you've learned and make it functional in nursing care. If you have any questions or need more information, please contact me, Bailey Woods. The phone number is 864 646 1620. Thank you.